Alright, welcome back. It's that time. It's a sore subject we're going to be covering here. Herpes. Herpes is obnoxious, alright? They never go away. They just keep coming back. And man, are they painful. I mean, my friend told me that they just are killer. Alright. Anyway, our protagonist for this sketch is going to be Hermes, the ancient Greek messenger god. His name has an uncanny resemblance to herpes. Whenever you hear herpes, it should be easy for you to think of your new friend, Hermes. Alright, I'd like to start by helping you get to know what kind of dude Hermes is. He's a DNA virus, as you can see by the blue, cold tones of the background. And Herpes simplex is a member of the larger herpes virus family. Remember not to confuse the two. The herpes viruses are a family of several viruses, but here we're just talking about specifically herpes simplex virus. Like the other herpes viruses, herpes simplex is enveloped, which we've represented by this velvety little robe he's wearing. Like most other DNA viruses, he replicates in the nucleus, and he's also double-stranded and linear, which is illustrated by the road lines below him. See, there are two straight lines on the road for double-stranded and linear. So this is kind of a boring outfit, so let's spice it up a bit. We're giving him a dry cowhide, representative of Cowdery bodies. These are host cells that have these big, red, eosinophilic intranuclear inclusion bodies that look like targets. And you can see these in other herpes viruses as well, such as CMV or VZV. However, remember that the Cowdery bodies are intranuclear versus pox virus, which have similar inclusion bodies, but they're in the cytoplasm. So now, how is the virus transmitted? Herpes simplex has 3 slippery modes of transmission. 2 of them are obvious, sex and saliva. But herpes is also famous for being vertically transmitted, i.e. as a torch infection. See this torch we're drawing here in his outstretched hand? This is a recurring symbol for most of our torch infections, and it's very important to remember herpes as one of the H's. And now he looks like a true Olympian. There are 2 strains of herpes simplex I'd like you to know about, and knowing them will give you major cred with your friends, at least the one of whom is bound to show up at your doorstep at some point to ask you to look at a suspicious-looking sore. Our subsets are herpes simplex 1 and herpes simplex 2. So starting from the top, let's review HSV1. In general, HSV1 is usually confined to the upper half of the body. So I know when you think of HSV1, you think immediately of cold sores, but when it first infects, it usually presents as gingivostomatitis, which is more aggressive and far more painful. And this happens actually more often in infants. It causes widespread inflammation of the lips and the gums. So we'll give Hermes a luscious pair of inflamed lips to help you remember of this first sign of infection. Eventually, this will just turn into what's known as cold sores. And so we've added some ulcers on the lips, and this is called herpes labialis, or lip herpes. It's the most common viral infection of the mouth, by the way. In fact, many of you watching have probably experienced this before. HSV1 also causes keratoconjunctivitis, which is a pretty serious eye infection that warrants eval by an ophthalmologist. And under a fluorescein-stained slit lamp exam, you'll see these serpiginous ulcers on the cornea. Serpiginous just means snake-like, so we'll draw in 2 snakes curling around Hermes' staff to help you remember these snake-like ulcers seen in keratoconjunctivitis. Okay, now comes the big one. If there is one thing to remember in this video, it's that HSV1 is associated with temporal lobe encephalitis. So we have Hermes wearing a helmet, and it'll have these red wings extending out from the temples. This will represent temporal lobe encephalitis. This kind of encephalitis causes hemorrhage and necrosis of the inferior and medial temporal lobes. His black helmet represents necrosis, and the red wings represent hemorrhage. This type of encephalitis has symptoms that include the usual fever, headache, seizure, and altered mental status. But herpes encephalitis has the added bizarre behavior and olfactory hallucinations and just overall personality changes. By the way, herpes simplex 1 is the most common cause of sporadic encephalitis in the USA. And now that we're talking about it, Hermes is looking a little crazy in the eyes too, to represent confusion or a change in personality. I also want you to remember that HSV1 remains latent in the trigeminal ganglia, and it's often reactivated by stress or immunocompromisation. So see these 3 gems, or trigems, we're drawing on the side of his helmet? This is exactly where HSV1 hides, the trigeminal nerve. It makes sense too, since HSV1 is usually confined to the face, so it just lays latent in some of those nerve nuclei. Now, you may have been thinking that Hermes is leaning forward because he's flying. After all, that's what he does. But you'd be wrong. He's actually tripping, that clumsy deity. On his way to deliver some roses, he tripped, and as he's falling, he tosses the roses up in the air, and you can see some dewdrops flying off of them. And there's also still some dewdrops on the roses, so let's zoom in on that. And I'm showing you this because the herpes rash is said to have a dewdrops on a rose petal appearance, named because of the clear vesicles sitting on top of an erythematous base. It'd be pretty simple to show you some vesicles on a groin or on the lips, and obviously you'll be thinking herpes. But something that would be more tricky would be to show you herpes on a finger, because this has a special name. It's called herpetic whitlow, and it's caused by herpes virus 1 and 2. It's more common in dentists and other people who spend time with their hands in many people's mouths. We have these dewdrops placed on Hermes' extended finger to help you remember to think of herpetic whitlow if you see vesicles on a finger like this. Of course, it can also be transmitted with contact of genitals to hands via HSV2. Another dermatologic finding associated with herpes, more so for HSV1 than for HSV2, is erythema multiforme, which is a hypersensitivity reaction which causes small target lesions, usually seen on the backs of the hands and feet, that then move in centrally. And the rash typically appears a week or 2 after infection with the virus. So since Hermes is clearly a postal worker, we'll add some postage stamps with targets tracking all the way up his arm. And this is erythema multiforme. Erythema multiforme is also associated with other viruses, bacteria, and even drugs, but this is probably one of the most common associations. Alright, now for herpes simplex 2. This one happens down below in the nether regions, and it's transmitted by any action that happens down below, sexual or obstetric. It causes herpes genitalis, painful inguinal lymphadenopathy with clusters of vesicles with a red base. When distinguishing genital lesions, remember that some are painful and some aren't. Herpes is definitely painful and vesicular, which is sort of a buzzword. Although we're not going to throw in a Marilyn Monroe-style gust of wind to give you a full frontal view of Hermes, but you'll notice we're adding some tufting around his skirt to represent inguinal lymphadenopathy. So if HSV1 is latent in the trigeminal ganglia, where is HSV2 latent? We're going to draw on this triangular metal codpiece, and it's meant to look like the sacrum, to help you remember that HSV2 lies dormant in the sacral ganglia. While HSV1 is associated with encephalitis, HSV2 can cause aseptic meningitis in adolescents and adults. To symbolize this, we'll put our classic neck brace on herpes. Man, Hermes is really starting to look pretty messed up. Alright, like the others in the herpes virus family, PCR is the test of choice for diagnosis. However, before PCR was adopted, you'd have to scrape the ulcer base and perform a zinc smear. It's an old test that's really no longer clinically relevant, but it may somehow sneak onto a test, and it's a good buzzword that should make you think of herpes. When you perform a zinc smear, you're looking for multinucleated giant cells, which are characteristic of herpes infection. So to remember this, we've drawn in a kid here playing with a tank on the side of the road. The tank is for zinc. And notice the camo on the tank? It's drawn to look like large multinucleated cells. Alright, what's the treatment? You may have heard that once you get herpes, you have it forever. That's so classic. People are so pessimistic. You don't have it forever, just until you die. So you can't cure it, but you can help prevent breakouts. And you can use either acyclovir or valcyclovir. To help you remember which antiviral to give poor Hermes, we're going to draw a big recycling bin behind him. This will trigger the word cyclo in acyclovir. And because the bin is violet, hopefully you'll think valcyclovir. And that's all for herpes simplex. It's a decent amount of information, but I think we covered it well.
So hopefully, unlike herpes, you won't have to keep coming back and back and back to review it.